A very important problem we are looking for a solution with ITC is about maternal mortality. We have in these two scenarios very remote areas with no access for communication and no access for electricity, and areas like Peruvian forests. For the most remote areas, we are prepared for a complete kit to prenatal care with a basic ultrasound scanner that can be connected to a laptop with a USB, a solar panel, so this can work independent of the presence or not of electricity, and also with papers for dry blood tests and urinary tests. We are working now with these kits in Guatemala with the project Healthy Pregnancy. We had included almost 800 women and have no cases of maternal mortality. And the second scenario is, as I said, in places with a good communication, we can offer a better diagnosis, making an ultrasound to check morphology and abnormalities like problems in the hair, in the central nervous systems, maybe in the kidneys, that can let us to join the team of treat for the patient, and specialists in ultrasound and in obstetric care. We are working in cooperation with an ONG from Guatemala. They choose the communities with the highest mortality for the area. And we are working with local nurses, and for the reference with the doctor from the hospital, the regional hospital. We started the project 1 year ago. They received, I traveled to Guatemala to train them in a very intensive week. But it's a basic training. It's not necessary to be performed by a specialist in ultrasound. And we train people, they never saw an ultrasound and they never touched an ultrasound scanner. And they are working now with them very well.
Well, on one side, this European project tries to research on the next future, to find how to develop this, provide this mobile communications. That is not the future. Everything now is developed for mobile applications. So now we have to move to this area, and even our telemedicine services, we are trying to provide them with mobile communications. And in the area of this project related with maternal health, this healthy pregnancy, the AST Foundation now is trying to find business models that can use the health insurance systems of the countries to cover the cost of the project. So instead of applying for funding from Europe or from other international agencies, we try to develop a business model, a social enterprise in the base of the pyramid to get funds from this health policy insurance to cover the cost of this test for a pregnant woman that are around $25 per pregnant woman, which is quite affordable for some governments in Latin America, for example.